While countries around the world continue to mobilize to contain the spread of COVID-19, mental health experts say we can't lose sight of an equally alarming issue: the long-term mental health impact the pandemic is going to leave on society.
What I think we're facing here is a very traumatic event for a lot of people. It's a traumatic societal event for people. And one thing that we know about trauma is that while it's happening, you do whatever you can do to survive. You bear down and you just get through it, which is what we're all trying to do right now. I think that we're still very much in the trauma phase, the active trauma phase of this pandemic.
But what happens after physical distancing measures are lifted? What comes after the pandemic is over and people are able to get back to whatever their normal may be?
There's going to be residual stress, depression, certainly financial pressures, learning how to re-engage with the world in this new way. That's going to be difficult for a lot of people, and those are exactly the kinds of risk factors that lead to increasing rates of depression, anxiety, and even suicide.
The rapid spread of the pandemic gave little chance to prepare for or even process all that has happened in terms of job losses and the complete uprooting of everyday life and relationships. Maggie Hu is a student at McMaster University who suffers from a generalized anxiety disorder.
I shut down because I don't know what to do. I'm not prepared for this. I did not run a rehearsal of the situation in my head. It's exhausting to not worry because it is practically impossible for me to not worry.
Hennick says for those already suffering from anxiety and depression, the pandemic could be exacerbating their symptoms. He is also concerned for those who have never suffered from any mental health issues in the past and are now facing a life disruption without fully digesting the long-term impact this may have on them. A large body of scientific studies show that there is a close relationship between indicators such as unemployment, mental health, and suicide. Research out of the Great Recession of 2008 reveals that a 1% increase in unemployment was accompanied by a 1% increase in the rates of suicides in the US. Hennick explains there is a peak and a valley response in our nervous system when faced with trauma. Right now, we are at a peak in which we are engaging with the immediate threat of the pandemic. You go into survival mode, which can be very taxing on a person's mental health.
And in fact, it doesn't actually let you think through or process what's happening to you. Its only interest is in keeping you alive and keeping you safe.
Once the pandemic is over, there will be a valley in which we recover from that threat. But the problem is, going back to baseline without support can take a lot longer than we may think. After the threat passes, Hennick says people can start to retreat or fall into depression or find many other ways of dissociating themselves with the trauma they experienced.
It can really become almost an infection on its own. Some people stay stuck either way at the top of that peak, or they stay stuck down at the bottom, or anywhere in between. Not everybody returns to baseline, and that's where we become concerned about mental illness.
In Canada, we currently have universal medical care, but things like psychotherapy, which Hennick says has proven to be an effective treatment for mental health problems, generally isn't funded publicly. Hennick says the federal and provincial governments need to step up to make sure proper treatments and programs are funded, so as many people as possible have access when in need, adding that everyone, including employers, will have to play a role.
I think it's important for employers in particular to realize when we start to loosen some of the restrictions that we're currently facing, that this needs to happen slowly, that we can't go back to the way the world was overnight.
As for Maggie, she says she already knows she won't be able to go from 0 to 100 right away.
I hope that with the virus slowly dying down, my social supports like psychiatrist, counselor, therapist, I'll get those supports back slowly and help me with my current fears and uncertainties.
Thanks for watching. To stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big issues around the world in our weekly series, Global News Explains.